First tonight, we have the latest on the coronavirus. In the United States, we know there are now at least 130 cases and 11 deaths. 10 of those are in Washington state, around the Seattle area. Most of the deaths are linked to a nursing home in Kirkland, and the CDC, along with other federal investigators, are now looking into whether that home followed guidelines to try to prevent infections.
Here in Oregon, there are 3 cases. One of those is confirmed as coronavirus by the CDC. But the Oregon Health Authority is monitoring 115 patients.
Those 3 cases have held steady, though, since Friday, so there is that. The governor, though, is still reaching out to the public to provide information along with state health experts, and she's doing that in a Facebook Live event. Our Lisa Balick was at the governor's office today and joins us live out of Salem. So what did you find out from that Facebook Live, Lisa?
Well, we found out that the state is running about 80 tests a day to see if people test positive for the coronavirus. They tell me that they have 1,500 test kits available. So far, no children have tested positive.
Most people who get COVID-19 experience mild flu-like symptoms, and that's the good news. These typical symptoms include fever and cough, and about 4 out of 5 cases, they're very mild.
Oregon state health experts working to calm fears as Oregon begins its odyssey with the virus.
Congress has just this morning negotiated a bipartisan emergency funding package of $8.3 billion to combat the coronavirus.
In their Facebook Live conversation, they responded to online questions, explaining that the virus is not as contagious as measles. There were questions about what companies should do to protect workers.
I don't think we need to deep clean businesses particularly. I think maintaining a regular schedule of regular thorough cleaning is the right thing to do. And it's a good thing to do all the time, especially during cold and flu season.
I wanted to know more about why the Public Health Division is not sharing all the locations of where those with the virus have been before they were diagnosed. The health experts say it's far less contagious than measles.
More the concern that you're going to scare people with it if locations were put out, where somebody, let's say, is in a grocery store and they're walking by and somebody's sneezing at that time.
It's not that we're worried about putting people being more at alarm. We don't think there's any additional risk there.
State health workers are reaching out to people who have been in close contact with patients who are diagnosed to have them self-quarantine. It's why they suggest everyone have a 2-week supply of food and water. The health leaders say basic household cleaning products do work to remove the virus on surfaces, saying the virus survives from 1 to 3 hours. I asked whether any of these state leaders would avoid flying or being out in public right now. They all said no. Again, a big part of their message today is that most people recover from this virus, but again, we are just at the beginning like every other state with this. Live in Salem, Lisa Balick, KOIN 6 News.